Good evening, everybody. We'll be starting this meeting in the next 2 minutes. Good evening,
Can you
ma'am.
see the
Ma'am,
screen?
would you want to try again?
Can you see the screen now?
No, ma'am.
I think better you all
Nothing yet.
start the screen. I have sent you the screen. You do it there. It's better that
Sure,
way.
ma'am.
You don't
No
waste
problem.
time.
Yes, ma'am. Okay, so good evening, everyone, and welcome to the Gyaan Vardhini session number 19. I'm An from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of the amazing Clinsav app that we have developed over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, doing follow-ups with patients for any outstanding dues. Clinsav also sends automated appointment reminders 1 day in advance to your patients through SMS. And it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. We shall be starting our today's webinar now. Our today's webinar topic is back remedies and its benefits. Our distinguished speaker for today is Dr. Shilpa Dhoka. Dr. Shilpa Dhoka is a Mumbai-based Ayurveda Charya and a holistic wellness practitioner with over 31+ years of overall experience. She is certified and trained in rich traditions of Indian Ayurveda practices from the prestigious Mumbai University, Mumbai. A passionate believer of non-invasive medical approach, she has keen understanding of natural herbs and their benefits. Over the last 2 decades, through the well-recognized process of pulse diagnosis or Nadi Parikshan, she has guided her patients in different parts of the world to everyday healthy living based on their body type and constituents, or Tridosh. Dr. Shilpa has done courses in Panchakarma, Reiki 1, 2, 3, basic obstetrics of gynecology and family planning, basic course in first aid, basic of preventive aspects of pediatric medicine, education course in diabetes for family physicians, and basic of acupressure and natural medicines from various institutes in India and Indonesia. She has successfully combined her training in Ayurveda with alternate healing practices for painless and healthier life. She treats a wide array of ailments which affects everyday peaceful living given modern day life challenges of pollution, stress, and increasing presence of harmful chemicals in the food chain. Ranging from common cold and flu, tonsillitis, acidity, she also treats allergy, asthma, digestive disorders, rheumatoid arthritis, skin disorders like psoriasis and eczema, type 2 diabetes, menstrual disorders, PMS, menopausal issues, and body detox, amongst others. Dr. Shilpa, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Shilpa Dhoka for today's session. Dear ma'am, you can start with your session now.
Thank you very much, Anand. Thank you for the introduction. Sorry, you all will have to start the. It's my privilege to be here. Thank you to the Gyaan Vardhini to give me this
Sure,
opportunity
ma'am.
to speak. We'll have to make it a bigger screen.
Yes, ma'am.
It's very small. Can we make it big?
Ma'am, it's full screen.
Okay, on mine it's coming very small.
Oh, okay.
It's okay. As far as it's big, that's
Ma'am,
fine.
I'll just check back with Dr. Snehil. Dr. Snehil, can you help with just checking this? If this looks good to start with.
Yes, yes. The slides are clear and visible.
Yeah,
Okay.
thank you, Dr. Snehil.
So, thank you, Anand. Thank you for everything. Thank you to manage the slides for me. So let's, without wasting time, let's start the topic. So I'm going to talk about Bach remedy. Now, the first thing is the Bach. Is it called Bach or it's called BACH? So there is a lot of confusion. Before we go ahead, let me speak about this. It's a German word, and that's why it's called Bach. It's not called BACH. But yes, if you want to call it BACH, also is fine because it is BACH. It's a German word. That's why because it's from there, and this remedy has come from England. That's why it's called Bach remedy. Okay. So we go ahead and we're going to talk more about this. Let's go to the next slide. Okay, now what is Bach remedy? Before I go ahead, can I ask how many of y'all have heard about this remedy, or how many of y'all are already using this remedy? Y'all can put it in the chat box so I can see it. If anybody knows about it, or anybody has read about it, or anybody is using it. Okay, Snail is saying is new. Anybody else? Okay, so so I'll give you a brief introduction about this remedy. Okay, so it's like first time. So the slides have gone. Is it still there? On my screen, there's no slide.
Yes, slides are not there. There must be some network issue. I'm just checking with Anand. Hold
Okay,
on, ma'am. You can continue.
Yeah.
You can
Meanwhile,
continue.
no worries. So see, Dr.
Yeah, I'm sorry. I'm sorry, I got disconnected, ma'am. Yeah, I'm
No
back
worries.
again.
I will continue talking. You can just put the slide meanwhile. So Dr. Edward Bach, he was an English doctor. He was a modern medicine doctor. He finished his education in modern medicine, and then somehow he was not satisfied. So around 1930, he discovered Bach remedy, and he's the person who's got it to the world. Now, what is Bach remedy? So Bach remedy is flower. It's made out of flowers. So what he did was, he collected, when he went for a walk, he collected few flowers and he put it in a glass bowl of water and left it in sun for some time, for 2-3 hours. After that, when he checked the water already had the effects of the flowers, and this he started using as remedies. And he gave us around 38 remedies, out of which 37 are actually remedies, and one is a combination of 5 remedies, which is called rescue remedy. So, I don't want to put a lot of time into the remedy part, but how it is made and all, because we don't make it at home. We just get it from the market. It's freely available in the market. So we just need to know what it is. There are 38 remedies, and yes, many people are using it as preventive effects. For me, I am using it very much with the combination with my Ayurvedic medicines. So we'll go ahead and we'll see how it is. It's up to you how you want to use it. Let's go to the next slide. Okay, do Bach remedy work? So what Bach remedy, the principle of Bach remedy is to restore the balance between mind and body. the negative emotions, same like Ayurveda principles, the negative emotions are the main cause of the problems in our body. So Bach remedy helps to restore the negative, like to settle the negative emotions and bring a balance between mind and the body. It is used in the conditions like anxiety, depression, stress, emotion, anything. It can be taken as a combination to support for the mental emotions, like anybody, if anybody's blood pressure is high because of stress at home, even though we give the blood pressure medicine, but we don't get results, but when you combine it, our results are faster. So I use it a lot in my practice. I combine it with my Ayurvedic medicines. The results are mixed. Some people call it placebo, some people are very happy with it. Like I have a patient who said that I'm using it, and her allopathy physician said that, oh, you're just, it's a placebo. She said, but I'm getting results, I'm using it. So it's different people, different things, but I get a lot of results. I'm very happy with it. So we'll talk about it as we go ahead. There is no paper, no research paper that can claim its support. Like we cannot say that, okay, there is any, this research has been done, that has been done, nothing has been, like nothing is still proved, because still they take it as placebo. Next slide. So Dr. Edward Bach, who invented this, his main feeling where he believed that healing negative emotions will help heal the body. Again, this is the same thing as Ayurveda. When we say that our mind and body works together, mind has to be clean and settled, then only the body will settle, that all the three dosh will settle. So they also have the same belief. Next slide. Okay, so what Dr. Bach did was, Dr. Edward Bach, he collected all the emotions that can cause illness, and he grouped them into 7 parts, like fear, uncertainty, loneliness, oversensitivity, sadness, concern, lack of interest. If you think for a second, you will realize that most of the emotions come under this. Nothing was like remaining. And what he did is, according to these 7 emotions, he has made different remedies. Like he has made few remedies for different types of fear, few remedies for uncertainty. So that is how he has created the remedies, and that is how we are using it ahead. Next slide. Okay, so now I'm directly going to the cases, because that will be much easier for you all to understand. So the first case I'm going to talk about, a female who came to me. She's 54 years old. Now, she called me one day and she told me that I feel very low. My husband doesn't have time for me. So I need to do something. So yeah, it was a casual call. I said, okay, fine, think about it. And suddenly after a month, I get another call, and where she says that I am very suicidal. I'm feeling very sad. I just don't know. I feel like I don't feel that there is a need of me in the society. I don't think I can do anything. And like every negative thought that she could tell me, there was sadness, she was irritable, there were many things. So, I just couldn't understand. It was all on the phone call, because I do a lot of online consultation. This was all on the phone call. So immediately, that minute, because I was a little worried, this patient was a very, very positive patient. I have never heard her talking all these negative things. So I quickly told her, okay, just go outside. And these Bach remedies are available in the homeopathic shop. They're not available anywhere else. They're only available in the homeopathic shop. So I just told her, go and get Vervian and Holy. These are the names. As we go ahead, you will listen to different names of the Bach remedies. I said, go outside and just buy them and start using that. You won't believe, within 12 hours, this is in the evening at 5 or 6 o'clock, I told her to do this. I told her every 1 hour, just put 2 drops in some water and drink it. Next day morning, she called and she said that 50% of my mental balance is better. I'm feeling so good. All the thoughts have gone. I'm very positive. So then we continued that with that medicine for 1 more day. Then after 2 days, we discussed what is the problem, and the story that she told me, I want to narrate the story so that you can connect with what had happened. So this is a husband wife story where everything is going on very well. Everything is, they're very good friends, doing everything together. Suddenly husband does something without, like she didn't want the husband to do that, and the husband did he went out somewhere where she didn't want him to go. And that really hurt her. And it became like her ego issue that I have told no. In our 25, 27 years of married life, he never did this, I never did this. We both were always together, and suddenly now he did not listen to me. I have wasted my time. That was the stress that was killing her inside, that my husband stepped out without my uh, wish, not permission exactly, but wish. And then the negative thoughts had started, and she started hating her husband because of that. The same husband whom she never had an argument for the 27 years. So that's where suddenly, then when she told me all the story, then I changed the medicine. Then I gave her something called mimulus and rock water. And then I told her, let's go to the psychiatrist. So I called her, and then we went to the psychiatrist, because we didn't want to miss anything. So we went to the psychiatrist. Psychiatrist also checked, and the psychiatrist said that you're overthinking. And he gave few medicines. He said, take this for 7 days, you'll be fine. But the patient did not take those medicines. Patient continued with our medicines. And so challenge here was, she didn't want to take any psychiatric drugs. So she continued the medicines continuously for at least for a month. After that, one day she said that I want to go out for a drive, but I feel that I don't have the confidence to drive the car. So okay, we changed the remedy. I added one more remedy to it, and then she was fine. So see, all these things continued for 2.5 months. Slowly the medicines were tapered. In fact, the patient didn't ask me. This is very normal. We all know in our practice, as soon as the patient feels better, they don't want to take the medicines. So she started tapering the medicine by herself. Also, of course, one more thing, I was also giving her Ayurvedic medicines with this. That also she started tapering. And unfortunately, just yesterday, she called me back again. She said that I am back to the square one position. I'm today feeling the same thing, like I'm useless and all that. Just yesterday, she called me. Yesterday night, again, I gave her two new medicines. And today morning, I got the message that I'm perfectly fine now. So, what I want to show here is these drops are so effective. Within 2-3 hours, we get results. So when we incorporate in our daily, in our practice with our Ayurvedic medicines, or whatever medicines we are practicing with, we can get better results. It becomes much easier to manage the case. Next slide, Anand. Okay, now this is a very different case. This is a 44-year lady. So this patient, I have never spoken to the patient. Her sister had contacted me. The sister stays in Dubai, okay? And so the sister contacted me, and she said that I have a sister who's 44 years old, and she doesn't, she's not married, she's educated, but she's in a very bad shape. She doesn't take shower for months. She doesn't tie her hair. She doesn't comb her hair. She doesn't change her clothes. She starts abusing, everything possible, whatever it was. And she's not taking medicine. She's not doing anything. And the way the sister was explaining, she said the story is like when she was young, 20, 25 years old, she was very, very dominating, bossy. And she used to think that I am the best and I should get everything best. Whether it's a job, whether it's a college, whether in the house, if anything is there, everything she should get the best. So that superiority complex which was there in her, that started growing on her, and then slowly she went into depression. And her family also, in the starting, they were supporting her, they were giving her medicines, whatever they were doing. But slowly the father passed away, and then the mother also got sidelined, because I think she also got fed up of taking care of her because of her bossy nature, because she was abusing, troubling and all that. So there was a son, and the daughter-in-law came in the family. The mother got busy with the daughter-in-law and the grandchildren and all. So they stopped taking care of the daughter, whether she's taking bath for a few days, not taking bath, whether eating, not eating. So it was just going on. So this sister who's in Dubai, she decided, okay, I will take my sister to my house. And then when the sister went to Dubai, now she called me that I want to treat my sister, please help me out. And then she explained all these things, that she doesn't change clothes and all these problems. So, we spoke, and then I gave her just 2 remedies, that is wine and wild rose. I gave her 2 remedies. After 2 days, I get a message that she has taken a shower by herself, like without anybody pushing her to take a shower. She's taken a shower, and then so she also, you know, because she is not taking care of her health, she also has, she's a lady, but she has a beard. Her hair is in a very bad shape. Then secondly, she told that please call the salon lady. I want everything to be cleaned and everything. I want to look pretty. But of course, she said that I am not going to support. I'm going to be sitting on the chair. Y'all hold whatever y'all want to do, y'all do. I'm not. So the dominating nature was still there. The bossy nature was still there. Then we again added some more medicines, some more, like I added holy and honeysuckle I added. And then after 1 week, because I normally give the remedies and I try to recheck after a week. I don't change in every 2 days unless there is something very important, or like, you know, some different case, like this case was very difficult case. So yes, I said that whenever you all want, you can reach out. Otherwise, we'll change the remedy. We'll see the results in 7 days and change. Now, next time when I talk to them, they say that she started washing vessels. Of course, she makes a lot of mess if there is a lot of water spilling out and all. And she's come down to the dining table to eat dinner, and that was there. Of course, when she's eating the dinner, she's spoiling things. She's abusing people on the table. It's like she has her things, but you know, we could. The positive part was there was some improvement seen. And finally, now when we have connected her to a psychiatrist, the psychiatrist has confirmed that she's a schizophrenic, and now the psychiatrist and me, we are giving medications parallelly so that we can get faster results. So here again, now the challenge that we had is we want to make the patient independent, and so that it becomes easier for the caretaker. Otherwise, she doesn't listen to the caretaker. She doesn't want to change her clothes. She gets periods. She's all like everything is in a mess, but she doesn't want to do, doesn't want to listen to anybody. So that way, you know, now we are getting results. This case is with me for last 2 months, and we have seen so much of changes, and we're expecting much more than this. Next slide. Okay, this is a male person, 42 years old. He's an engineer, and he came to me around 2.5 months ago. So when I started talking to this person, you know, he speaks, but I couldn't understand what he's speaking. It was like he speaks something. Sometimes I used to feel that he thinks faster than what he speaks. He's unable to talk. Suddenly he will jump, he will talk in his mind, and then he will suddenly, it was like, you know, very difficult to understand what's going on. And I could see the patient is in depression. There's a lot of anxiety. So he had lost his job in COVID. After that, he never attempted job. His family members were really like worried for him, what's happening, and he's not ready to take the medicine. That was his biggest problem, that whether it is Ayurvedic medicine, allopathic medicine, he doesn't want to take medicine. He doesn't believe in all that. He's super intelligent, so he has a question for everything. He researches everything a lot, and he feels that everything is a side effect, so he doesn't want to take. So the family members had contacted me and said that somehow please help us. Again, we started talking. I started giving him all the remedies, like I normally mix 2 to 3 remedies together. I started giving him remedies, and from here 2.5 months has gone, and last Friday he went to the psychiatrist, because this case was something I knew that I couldn't solely work on it, because you know, the symptoms were different. It was, so the psychiatrist diagnosed him as a psychotic disorder with a non-specific origin, and the psychiatrist has also put him on medications. Now he's taking Ayurvedic medicine, he's taking Bach remedy, and he's taking the psychiatric medicine, and hopefully we are going to see better results now. So again, here, you know, what I achieved was, he was not ready to go to the psychiatrist. He was not ready to accept that he needs a treatment. So the goal here was, first thing is to make him understand that he needs a treatment, and then prepare him to go to the psychiatrist. So that was very important for us, and we achieved that. Next case. Next slide. Sorry. Okay. This is a patient, 42 years old lady, and she came actually to me for adenomyosis. But as I was talking to her, these are the other symptoms that came out. Like, she's a very anxious person. She has a lot of fears, sleep. she cannot sleep properly. And she says that even if a glass of water is in front of me, I cannot take, I know that I'm thirsty, I know that I have to drink water, but I can't even take a sip of water. She has a lot of mood swings. Her family, like relations with her husband, is spoiling uh, because of her mood swings and all. She's losing interest, and low libido is there, losing interest. And so it was very difficult. Of course, she didn't come for this, but as we spoke and as I understood, all these symptoms were all, like, in Ayurvedic terms, the vat had gone very high. And I was also treating the adenomyosis, but I started Bach remedy with this. And you will not believe, within 15 days, there was so much of a difference. The husband was very happy. She was happy that her family life is settled. She's able to eat. And then she was planning to go to Rajasthan. So she called me. She's from Bombay only. She called me, I'm going to Rajasthan. Should I take these drops together? Do you want me to add some more drops to it? So, she was so happy with the remedy that now the person who was not so keen, she had almost given up that, okay, these symptoms are going to be with me. I have tried everything. Nothing is going to happen. You just focus on adenomyosis and sort that. Now last week only she came to the clinic. Her adenomyosis size has reduced. That is, of course, I was doing Ayurvedic medicine also. But I also feel, because her mental stress, the anxiety is gone down. Everything is gone down. The adenomyosis also, it also helped the adenomyosis to shrink. So it's always good to have a parallel support with the Bach remedy, I feel. Next slide, please. Okay, this is a 88-year-old auntie, I would call her. So she came to my clinic, and she's like big. She's heavyweight, heavy, and she's able to walk. She's fit. There's no problem like that. But she will not walk. Anything we tell her, auntie, can you please walk? No, 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 my knees will pain. I don't want surgery now. I used to play badminton, but I don't want to do this. Anything you talk about, and she has a story for it or an excuse for it, that I don't want to do this. And the way she was talking, I felt like, just 6 months ago she was playing badminton. 6 months ago she was going down. Like, she started telling me, oh, I would normally go down, take a cab and go and watch a movie. I would do everything, but just stop now. But I realized, I'm listening to her the whole thing. After that, her daughter was with her. So the daughter told me these are all stories 10 years, 15 years ago, but she's just talking as though it's just happening now. But she was not ready to do anything. And apart from all these things, the domestic help who was there at home, she would throw tantrums. She also used to slap the help, or she used to, the whole life she was very good with all this domestic help or anybody else, very sweet person. Now suddenly she'll start saying that, oh, there is something in their bag, they're robbing, they're taking something away. So, things she had completely changed, maybe because of the dementia that is setting in. She is forgetting things, and so she's confused, and she's talking all these things. So her daughter had told me, do something so that we can calm her. And she's already on allopathic medicine. She's under the neurologist treatment. So everything is going on. We started honeysuckle and holy, and that's how she calmed down. And now, there is peace in the house, where otherwise the patient who had come, the daughter who had brought her, she was worried that sometimes she's slapping the help, sometimes she's telling that you are robbing something from my cupboard. The help will go, how will I manage? So that way she has settled now. So the main thing here is, giving something which can help them settle. Life is easier. It's sometimes, even if simple cases, it really helps, makes life much easier. Next slide, sorry. Next slide. Okay, this is the daughter. Again, the auntie who was there, the daughter, she has blood pressure, hypertension, and because of the mom's behavior, she was also having problems, and her BP was going up. And she didn't want, because when she went to her physician, the physician said, let's make that, she was taking the BP medicine just once in the morning. Now the physician said that let us take it in the evening also, make it twice a day. And then she told me, why don't you give me some medicine so that I can. So I just started a Bach remedy called Impatience. There's a remedy called Impatience. I just gave her that, and her BP started being stable, and she didn't have to until her mother settled. Now the mother also has settled, but her BP started settling and she didn't have to increase the dose, so that she's very happy with that. So this is the patient whom I said, when she went and told her physician that I have started taking Bach remedy and my BP is fine, he said, no, that's placebo, don't trust that. But she said that my BP is normal, I'm fine, so I don't mind taking it, we'll see later on. So she fought with the doctor that no, I will continue this. So it was nice to hear that, and I was happy to see the patient happy. Next slide, please. Okay, this is a 27-year-old web designer. Now, with this, this COVID and all, everything being online. So this patient being online, he would never go to the office. He didn't make friends. So everything is online. So, like no vitamin D exposure, no walks, nothing, just sitting at home and just doing work. So he was really feeling hopeless. There is nothing to do, feeling very low, a lot of mood swings and all that. And his family members also said that he had very big dreams, but no efforts. He would say that he would, when talking to others, he can tell a lot of things, or do this, do that, lot of good advice, very intelligent person. But when it came to himself, he would never put in efforts. So when the parents explain to this, then there is a remedy called hornbeam, which is very easy. Just give that, and the person who's not putting in efforts or who feels fatigue, immediately we see the results. So you will not believe, as soon as we started giving him hornbeam, he changed completely. He started thinking that, oh, I need to step out. Earlier he didn't want to work, like go to office. He wanted online work is better. Then he started giving interviews, he got a job, and now he's very happy because it, I give the whole credit to the hornbeam, because it really helped motivate him, and it helped creating hope. Okay, so it made it easier for him. I feel that he would otherwise never put in efforts. Maybe it was too much for him to, oh, I have to step out, get ready, take a train, go to the office. That was too much for him. He couldn't think about it because he graduated during COVID and he started working from home. So, but now when he started taking hornbeam, it helped him, it helped him get the courage to do all these things, and it really changed the life, so he is also very happy now. Next slide. Okay, this is a 23-year-old student. So the student would come to the clinic sometimes and he would say, anytime, either when the results are coming or when there is a exam or a test in the class or something, there suddenly I find butterflies in my tummy, I'm jittery. If I have to study, exam is in 2 days or 3 days, I really cannot focus. I get very anxious, what to do. So here I just gave him rescue remedy. Rescue remedy is a combination of 5 remedies. Again, we get it in the market ready-made. I just gave him rescue remedy. I said that whenever such situations come, just take a water bottle, fill up 10 drops into it, take sip by sip, and take it for a day or two, and you should be good. And now it's become his ritual. Whenever he comes, he says that, oh, doctor, you have given me a very good thing. Whenever I feel like this, I quickly do this, and I'm good to go. He's doing very well. His education is going on. He might be in the 3rd year or 4th year of his engineering something. Next slide, please. Okay, now this is a very, very different case. So this is a product manager. He's 33 years old, and he was going to get married in December. And with his friends, he went to Bangkok. So there's a nightlife in Bangkok and everything. He went there, he had a good time, whatever, and then he came back. And after that, he suddenly started getting some weird feelings in his ear, his tongue, around his penis and all that. There was a weird sensation, and that triggered, he started feeling that he's got HIV. So he immediately got a test done. HIV was negative, but the sensation was not going. And because of the sensation, he started feeling, he started reading a lot, what is HIV and how it is. He thought, another 3 months I'm going to become positive. And because of that, he started getting into depression, that I'm going to die now. Also, the fear was, in December he was going to get married. Now what is going to happen? He did not tell his girlfriend about anything, like fiance about all these things. He was worried, if I get married and then what happens if she also contracts HIV, what will happen? So the whole story started for the HIV, and his main thing was the weird sensations were not going. He had gone to all the neurologists, he had got all the tests done for the ears, for the ENT, for the tongue and everything, all the possible skin specialists, that how to get rid of this weird sensation. It was very difficult. So when he came to me, my main thing was to get rid of this weird sensation. So there is something called crab apple. There is a remedy called crab apple. It really helps. It helps to that any sensation which is there, which you don't like, which is troubling you, which is irritating you, it immediately helps to get rid of it. I just started with a crab apple, and within 15-20 days he told me that it's very little, I just get the sensation once in a way here and there, and within a month the whole sensation was gone. So once the sensation was gone, he was relieved, and of course he kept on doing his HIV test and all that. And finally, after 3 months, he told me, I now 100% know that I don't have HIV. I am out of all these things. So then we moved towards depression and anxiety. But because the HIV part was clear, the depression anxiety was easier to handle, and everything went out very well. And you won't believe, just today at 7 o'clock, he called me and he told me that I got a job in Meta and I'm moving to Singapore. So, it just happened. For the last 6 months, he was at home, not doing anything. He resigned his job because of all these things. But just today he said that I'm flying tomorrow to Singapore. So it was very nice. I was very happy, and I told him that I'm putting your case here. So yeah, it's nice to see people. And he was only like, he was taking these Bach remedies and he was taking pure Ayurvedic medicines, nothing else. Next slide, please. So here it is. This is a 55-year-old consultant. Now this slide, this case I'm telling because this is normally every house to house cases we see. Here now the case is like this person, he's worried about his work, about his office, about his family. He has a guilt that he spends less time with the family. He's overthinking. He wants to give the children the best things. He wants to give the office also the best thing. He wants to be at the best in the career also, but also feels burnt out. This is a very common feeling we will hear from most of the responsible people, whether it is a male or the female, everybody. So such feelings can be easily managed by Bach remedy, because Bach remedy combinations can help you sort out it. When there are perfectionists who want everything, it really, the people get burnt out nowadays. Burnt out is a very, by 40 people get so burnt out that they just don't want to do. I have seen, like, we all know Saurabh Botra, people like these who are big IITians, they've started their own business. Of course, I'm not saying that he's burnt out or something, but they leave their big jobs and they want to do something very simple and easy. But here Bach remedy really helps. Now this patient, I just gave him walnut, agrimony and beech, a combination of three, and then he's very good, he's very happy, he can focus on everything. So I have got a good set of results here. Let's go to the next slide. Okay, now, so I have given you these 10 cases. I have got many more cases. I can talk about so many cases, but now I can talk about what exactly it is. So, as I said, Dr. Edward Bach has made 38 remedies. So what the system is, each remedy has its own benefits. Like for agrimony, the first remedy is agrimony. Agrimony is one. I'm going to just explain few remedies so that you understand what I'm talking about. Agrimony is a remedy which we give to a person who smiles on his face. When you look at him, he's always smiling, but internally he's really, really worried. There's a lot of stress, lot of struggle going on inside him. So for that, we give them agrimony. So this is very common. Now second you can hear is Vervian. Vervian is a person who overthinks. So I usually connect them with our Prakriti. Normally in Ayurveda, the way we look at Prakriti, in Bach remedy also you look at the person's body type or mental type, and then you decide the remedy. So I normally connect the Ayurvedic ways, and then, like, suppose now Vervian, is given for overthinking people. And I connected, like, overthinking comes in Vat Prakriti people, or if the Vat is very high. So even if somebody is talking about arthritis, I will give them Vervian. So this is how I connect Ayurveda and Bach remedy, and I give it to them. So like I give Vervian, Mimulus, Rock Rose in anxiety. So these are the combinations which, like, Mimulus helps to fight with the fear. Rock Rose helps to give us the certainty. There is a combination that these are the combinations I made. There is no combination such that comes here normally. So how we do is, there are 38 remedies, and what we do is, when we are talking to the patient, I will write whatever symptoms. As I'm talking to the patient, I will write the symptoms, like, okay, this is the issue, this is, if the patient says, I feel nervous, I feel jittery, I am anxious, or I feel there's a fear, I don't want to go out or something, whatever they say, I keep on writing. And then accordingly, I will jot down which remedies I should give. So I'm going to jot down 10 remedies, and then out of that, I'm going to cut the remedies and bring it to 3 or 4 remedies. Then I make a mixture of 3 or 4 remedies and I give it to the client. And then how it is taken is, normally if it's a very emergency situation, then you can directly put the drops onto the tongue. Otherwise, I normally say, take a bottle of water, 500 ml water, and put 10 drops of the remedy into it and sip it throughout the day. If the water gets over, you can refill it and re-add the medicine. Sip it throughout the day. So as it goes throughout the day, it gives better results. But of course, in emergencies, we can immediately put it on the tongue. Like, see, impatience is, you can give it to even the kids who are, always running around, very, in a way we call them naughty kids, or very super active, hyperactive kids. You give them impatience, immediately you will see them. We are not, so see, there is no side effects, and it's not going to change the person's nature, or not, it's not going to become that the person is sitting just not doing anything. It's not going to become like that. Only thing is that extra hyperactivity will become into a normal person. It helps. Like crab apple, as I said it earlier also, in one of the cases I had given crab apple. So sometimes somebody, they don't like, sometimes somebody's overweight, sometimes the face has got a lot of pimples, skins, and also I use a lot of crab apple. Crab apple you can even apply directly on the skin. Any of the remedies you can directly also apply. I use a lot of crab apple on the skin for the patients. Or sometimes if somebody is very, like, a little bit fat, obese, and they feel shame, they don't want to step out of the house, they don't want to socialize, they don't want to meet, so I give them crab apple. It really helps. Sometimes also they don't want to accept other people, they're irritated by other people, again I give them crab apple and I see a lot of good results. Acceptance becomes very easy. In fact, there was a patient who was continuously, sometimes people, like, they don't trust others, they want to wash hands and they want to cook their own food and do things. So if you start giving them crab apple, there is a big difference. There's an acceptance, that OCD patients really get good results with crab apple. Like hornbeam, I just now had spoken about. If anybody is very tired, fatigue, sometimes we just wake up in the morning and we say, I'm so tired, I really don't want to go to work. Just open the bottle of hornbeam and take it, and immediately within 15 minutes you're ready to go to work. So hornbeam is something, very, very, very helpful, very easy to use, and it gives very good results. Now, Star of Bethlehem, it's very good. If anybody gets injured, walking or something, gets injured, children playing get injured, and if there's bleeding, you just give them few drops of Star Bethlehem or put these drops on the wound, bleeding immediately stops. If a patient is in shock, any problems, like some accident happened, there's a shock, or like this Air India crash or some shock you hear about, you give these drops, it helps the patient to calm down immediately. And then of course it's not like just one time and it's fine, then we continue throughout the day and the patient helps. I can talk about each of the remedies like this in details, but I think that can only happen once you do the course, you study it, and then only you can get into more details about these remedies. So another thing that I want to tell you is, if you're interested, if you're interested to know more about it or how to use it, so I had done a course, I had done a MD in naturopathy, and in that Bach remedy was a subject. That's how I got introduced to this, and I read it, I did the exam, and then I started using it. So how I started using was, it was very difficult to, or get like how do I give it to patients? I was not very convinced. So I started using it in my house, in my family, with my kids, with I took myself many times. So that is the easiest way, if you look at it, like the symptoms, if you remember the emotions that we spoke about in the starting, the 7 groups of emotions, we all face this emotion somewhere or the other. So if you can jot down few of these emotions and try few drops of these remedies yourself or in the family somewhere, and you see the results, that gives you confidence how to use it. Or there are few remedies, like walnut. Walnut is one thing where, anybody's got to change anything, you can immediately, like if you want, a child is going to school, it's the first day of the school, and the child is very nervous, give them walnut, they go and they settle very fast. These are small things which it helps. So we can keep a few of the remedies in the clinic also, like impatient, if somebody is just come and very impatient, like the patient has high blood pressure, you give them impatience, or you give them aspen also helps calming the patient. Verbian stops them from overthinking. Sometimes somebody comes in, or if somebody's in a shock, we can give them starbeclam. So I feel that if you have the remedy box in your clinic, and maybe you can make a chart, once you read it and you can make a chart, just quickly you see the fear, you see the chart, and then you can quickly give it. It can be very helpful, and you get a 36 remedy box directly. So then you can make your combinations. Believe me, there is no harm. Even if you give a wrong, suppose you out of the somebody needed agrimony and you landed up giving them beach, but there'll be no harm, because these are just flowers, and this is just the essence of the flowers that we are getting. So there is no harm. So there's, your patient is not going to suffer. So there's not going to be any side effects, or there's going to be any problems and all, nothing. It'll all be good. Every remedy will work somewhere or the other. For pain, there is a remedy. There are the remedies for everything. I feel, like Bach remedy has become my parallel thing. I do pure Ayurvedic treatment, but I also give, parallelly, I give a lot of Bach remedy, and it has really given me wonderful results. Next slide, please. That's it. Thank you very much. Thank you to listen to me.
Thanks a lot, Dr. Shilpa, for such an insightful and enriching presentation. Your expertise and knowledge have helped us with a deeper understanding on how the Bach remedies and its benefits session can be helpful to all the doctors present here. So before we conclude, I would like to open the floor for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Shilpa will address them. The Q&A shall be hosted and managed by Dr. Snehal.
Yes. Good evening, everybody. It was such a wonderful session, ma'am. A new insight, and I am just a blank slate for this, and I have no idea what it is. But yes, as you said in the session, that yes, Ayurveda has that part of Manavoha Srotas, and if this remedy is working on that part, and if we have a tool, as you said, that 21 set keeping in the clinic, and just patient is coming in and we can help through it. But for that, the first question is from myself. Any book you recommend for this?
Yeah, I have a book. I will just show you. I have a book. I can give you the name. Here it is. So this is the book. I will send you the picture. Maybe in the group I can send you the picture of the
Yes,
book.
ma'am. Yeah. Ma'am, I
I
can
knew
share the
that this
picture with
question was going
everybody.
to come up, so I kept the book ready. So this book, if you read this book, you can start practicing. You don't need to do anything else.
Okay. Second question is from Dr. Pratibha. Which company remedies you use?
So normally it's Bach remedy. I'll show you guys. So normally, see the Europe, we also get the European ones, the English ones, but they're very expensive. So I to use this one. So there's, I don't know which brand is this. This it's only written Bach Flower Remedy. It's New Life Laboratories. But there's nothing, no problem, you know, there's no harm. Whatever is available, you can use. It doesn't matter.
Okay. Dr. Agastya is asking, which course did you pursue?
So it was a naturopathy course. It was a master's in naturopathy.
Okay. And dosage for the kids, if we want to use in the kids, and at which age we can start?
Okay, for the kids, for the newborn also you can give. So one thing here, it is these remedies are normally mixed, because to preserve it, they're mixed with alcohol. So brandy is used to mix them, but people who do not take brandy, because there is a community who doesn't take alcohol, they don't want brandy even in medicines, so they are mixed in glycerin and given. So when it comes to kids, then we should use the glycerin one, not the alcohol one. We don't want to give the brandy one. And you can start it from the just born kids. There's no harm. There's no side effects, no problem. And the doses you asked for the kids, again, it's a, so for the adults, I normally give 10 drops in 500 ml. And as per the age, I reduce the dose, maybe 4 drops, 5 drops. It depends as per the age and the weight and the condition. It's more here, it's more of the mental condition than the age and the weight.
Okay. So whenever we are purchasing the formulation, we have to see if it is mixed with the brandy or the glycerin, and according to we have to purchase, right?
So normally in the market, you will only get mixed with brandy. So these bottle, like the one which I'm showing, these are all brandy ones. Okay. And the one, if you really want the glycerin one, then you buy the UK brand. It's called Bach.com. That's the brand. It's also available on Amazon. You buy that. That is the, it's not diluted. It's the real one. Like it's the concentrated one that you then mix. Normally what they do is they bring that, and if you want to give it in alcohol, you give it in alcohol. If you want to give it in glycerin, you give that.
Okay. And next question is, can we use these remedies for painful menses, PCOD, etc.?
Yes, 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 of course. I have given it to so many people, so many girls, and it has really helped. It has also helped in PCOD and painful periods also, because PCOD, the sizes change, the ovaries, the scans after 6 months change. The patient starts losing weight, everything falls in place properly.
Okay. So the questions I seem is like me, everybody is new to the subject. That's the reason the questions are. You told it to dilute in water, but in emergency, can we use it as a
Yes,
direct drops? And
yes, you can put it.
are there any contraindication for using direct drops orally?
So normally no contradiction, because see, as I told earlier also, you know, you take a flower, suppose you take rose flower and you eat the flower, just the petals, there's no harm, right? So these remedies are also made from, they are the essence from the flower. So that's why there is no harm. It's not like anything it's going to burn up something, or no, nothing is going to happen. Yeah, unless and somebody is allergic to something that we don't know, you know. Otherwise, there's going to be no harm. And of course, in emergency, it should be taken on the tongue only. The rescue remedy which is there, that I normally keep it for emergencies. You know, if patients come in the clinic and they are in a very bad shape, unable to talk, very much in shock, first I give them rescue remedy, 2 drops. Okay, now you sit down, then we'll talk after some time. And you know, within 2-3 drops, within 5 minutes, I see the patient calm and composed, able to explain what the patient is going through, what is happening. It helps. So it's always good to give on the tongue. When I say mixing with water and putting in the, because you know that then it runs all over the day. It helps to give good effects, you know. It otherwise, even if sometimes patients say that we don't like the taste, so we will only take it once or twice a day or 3 times a day in 1 glass, so that's also fine.
Okay. So it is like kind of sustained release dose in the water.
Yeah, in the water, we can take it as a sustained release dose so that it can work, because as I said, like the first patient that I was talking about, she started taking the medicine, she was fine. I told her to take it in the bottle, but she only wanted to take it like few drops, and as soon as she recovered, she stopped it. Normally, I don't want to stop it so soon because see, you're avoiding psychiatric drugs. Psychiatric drugs are like chemicals. When you have an issue, there is a medically, if you talk about it, there's a chemical imbalance. Ayurvedically, we talk about there is an imbalance of vat, pith, kaph. Now, if you wanted to stay back, you need to give a prolonged dose. Then only the patient will settle properly, and they'll not be again. Will not bounce back. The problem should not bounce back again. That is also a challenge. So that's why I prefer giving them in the bottle throughout the day. But if the patients don't want, then yeah, it's up to them. It's okay. Then they'll come, they'll have to take the medicine for a little more time.
Okay. In the case of PCOD patients, no other
Yeah.
medicines were prescribed other than back remedies, or it was supported as a remedy?
No. So I always support for all these things. I support both the things together. So because see, PCOD normally in Ayurveda we talk about is apart from the hormonal imbalances, it's also because of stress, because of so many other things, So the other things are taken care with this, and hormones will get balanced because if the mental state is fine. So I always give a combination.
Okay.
Like I can also give you one more example. I have a psoriasis patient. He, like you see the pictures, he would scratch, blood coming out, that much he would scratch. And then I started giving him all the Ayurvedic treatments, like all the Tiktaras treatment and everything. The results were very good. But as soon as there would be stress in his life, immediately the patches would come out. So once we started with Bach remedy, things changed completely. It became much easier for me. Then, even if the stress comes, the patches don't come because the Bach remedy takes care of the stress. And the patient also started understanding that, okay, whenever I'm going through a difficult time, there's a lot of different types of stress. Sometimes it's work stress, family stress, something or the other. So now he himself, okay, I'm taking these drops and I'm good. So it becomes easier. Slowly, the patient also gets educated about it, So I don't tell them the names what I'm giving. I just write on that. For anxiety, take this. For stress, take this. If you cannot sleep, take this. Like many people, when they're going in the flight, when there's a turbulence in the flight, they have butterflies in the tummy. So for that also I give them, then I tell them this is for travel. They really are happy with that.
Okay. Okay. And how useful these remedies are in ADHD cases, autistic kids?
Oh, they are wonderful, like ADHD, autistic kids, it helps to give them focus. It helps them because see, ADHD, there is a depression coming together. There's a hopelessness because when they are doing things and things are not happening, because they are wired in such a way that they think in one direction, they don't want to listen. So it helps them to accommodate, show that flexibility. ADHD, autism, it really, really helps very much.
So
I've had
I would
patients.
add one more thing is learning disabilities in the kids.
Yes, it helps the patient to calm down and to understand what happens is because learning disabilities, the kids are impatient because they cannot understand what we are talking. There is a difference in the wavelength, I would say, where they don't understand what we are talking, and it becomes difficult sometimes to communicate. But giving them Bach remedy makes it easier for them to understand. It really helps. It really helps. I've had a patient, the girl, the girl, she's in London now. She was born after, when she was 3 years old, she was detected with ADHD. And the parents had messaged me, and then we started with the medicines. Of course, in London, she's also doing therapy and everything. But in the starting, it was very difficult. She was not ready for therapy because she's small, 3 years, 4 years, very difficult. But with the Bach remedies, she started going to the therapist. She started listening to the therapist. And now she's 6 years old. There's a big difference. We can see. I'm not saying that only Bach remedy has helped. Of course, therapy has also helped. Therapy was, but to go to the therapy, to accept it, Bach remedy is the medium to get the results.
Okay, and the last question is, some patients always are worried. No, sorry, I missed the question. For elderly patients, especially due to long-term illness, etc., if there is irritability, anger issues, what can be used for and for how long?
So, depends on what is the anger and irritable, what is it, but how long, there is no problem. Lifetime you can give them. There is no problem. And so anger, if I know the case little more, then I can tell what exactly needs to be given. So if there is like if they're thinking about their old, what happens is many of them will be, when I was young, I was doing this, I was doing that, and then they are like creating anger. Then there is a different remedy, because there is an old remedy there. I will give honeysuckle. So, and if there is something else, so it depends on what is the position, what is the condition. I would try to analyze the anger and give the medicine accordingly. So if you like, you can anytime call me and we can talk about it, and I can tell you what remedies to give. But yes, you can give it lifetime. There's no problem. Like yesterday, I had a patient, 75-year-old lady, who, like, her son came and told that looks like mom is now not talking. She used to talk so much that everybody would say she talks so much, so much. Suddenly she's reduced talking. And then I just gave her agrimony and I gave her Mimulus. And like today, the person called me and said that she's fine. She started talking now. So basically, what agrimony does is a smiling face, but behind there's a lot of stress going on. So the stress, so I am so used to now giving the remedies and getting a WhatsApp message or, okay, things have improved. Very rarely I've heard that there's no difference. Rarely. I'm not saying that it doesn't happen. It happens, but rarely. So just giving them drops for 2 days, 3 days, and then they're fine. Some people, like, if there's a real case which needs a long-term treatment, then I do a long-term treatment.
Some patients are always worried for their health. Just woke complaints like, how can we help them? They are only self-centering kinds. So in those patients also, can we use the Bach therapy?
Yes, there is a Bach therapy, which is especially for the, like, over concerning, they are only worried about themselves. So there is a remedy which we can give. But yes, again, I'm not going to give you the names of the remedies, because, I'm worried you will just buy and give it. And we really need to analyze the person's personality and then give it. But there is 100% over concern for themselves. There is a remedy.
Okay. So this can do magic in exam session for students to handle stress.
100%, 100%. If nothing else, if you just give rescue remedy, rescue remedy is one thing, which is like an emergency. Like, we use the sorbitrate tablet for the heart patient. Just everybody keeps it now. Keep one aspirin, dispirin. Similarly, rescue remedy is one thing which I feel, if you don't want to do anything else, just keep rescue remedy at home, at clinic, and anybody who's in a panic situation, give them that. That's enough. Nothing else to do. Rescue remedy, I don't like, I can vow on it. I can give you the name, because it is something which will really help. There is no way that for exams and all, it really helps. Even people, if they have diarrhea, sudden diarrhea because of stress, immediately there is a result. You can also use this on plants. I forgot to tell that. On plants, you can use it. You can use it on animals also. Pets also, they get very good results. Okay. Dogs, cats. Like, I use it on my dog also. I have a dog at home and I use it on my dog also. Especially, when I have 2 boys. When my boys go back and the dog is missing them, he's barking a lot, then I immediately give him remedies and then he's good. In 2 days, he's good.
Wow, amazing. So I guess as you mentioned that it contains brandy, I feel that the question is related to that. Is this medicine addictive or can be stopped after a certain period of time?
So it is not at all addictive. You can, so as I said, I also give it for rescue remedy. You have to just give it for that moment. You cannot give it for, rescue remedy cannot be given for more than 24 hours. So it's not at all addictive. See, for the results, I give it for a longer time so that the results become stable. But otherwise, like you're going in a flight, I said, just take few drops. You're not going to take it every day. So it doesn't. No problem. Like it's not addictive. You can always, anytime you can change it, anytime you can do anything. No problem. You can stop it anytime. It can also be, I'm just giving new ideas so that y'all can understand. You can also use it in pregnancies, where there is a lot of mood swings we see in the in our patients, and then there's a, because the body changes, there's a lot of hormonal changes, there's acceptability is less. So when you give different remedies at different time, the patients really benefit with that, and they can handle their pregnancy much better. Even in the family, like again, there is no harm, the pregnant lady, the fetus, the baby, nobody, because when we are giving it to fetus and we're giving it to the newborn, there's no harm, there's going to be no problems, the baby is not going to be addicted, and there's not going to be any side effects. So don't worry. Even in the family, when in a family situation, see, there are siblings, there are so many responsibilities. Again, Bach remedy helps. It helps in like coping up the, I'm just giving out some, coping the changes, sibling jealousy, rejection of love, and there is some like somebody is very tired, fatigue, everything, it helps.
Okay.
Even the like delivery, traumatic birth process and all that, when the labor pains are started, you give her some remedies and she's calm, and the labor pain, the baby is born.
Amazing. Okay. There is a feedback from Dr. Anju. Thanks, Doc, for the different insight. Looks simple and easy to give. Would definitely like to try. So can we read the book and practice? That is the one question. And second is, postpartum depression cases will only BACH remedies help, or will you need something else?
No, so postpartum depression, I would say apart from remedy, a little bit of therapy is also needed. Like talking, somebody, whether it's a doctor talking or whether somebody needs to have to add, when Bach remedy, what it does, it gives you an openness. But then there needs to be somebody to talk and remove the things from inside so that the patient feels lighter, So that's why always, it's always a combination. Sometimes it's therapy, sometimes it's a Ayurvedic medicine or some other medicines that we use. But yeah, for such things where there is some depression or some mental illness involved, we need to support it with something. And you asked me whether we can start practicing with the book. Yes, you can start practicing with the book. Even if you don't read the book, I can give you another idea is go online, look for Bach remedies, bachremedies.com. There are so many Bach remedies website. What you do is, easiest way, look into yourself, and if you have, everybody has some or the other issues, just write down 4 issues there. Okay. It can be stress, it can be nervousness, it can be anything, whatever you want to write, or difficult to sleep and all that. And then you go on to Bach remedy page, and there you try to read. Every remedy will have that this is used in this is used in this, because it's just 38. You read something, if you feel, oh, this is matching with me, write it on that paper. This is matching with me, write it on the paper. So by the time you read the 38 remedies, you will have shortlisted 8 or 10 remedies. Go back and again read those 8 to 10 remedies and cut out which is less relevant. Reduce it until you reach to 4 or 5. Then you buy those 5 remedies and you try it on yourself. The issues that you have put up, the issues will be solved. That was the easiest way to do it. If you have a child at home who is very anxious for exams or something, or hyperactive children nowadays, though all the children are born hyperactive, I feel, with all this digital world and parents and everything, it's so hyperactive. So you can try that also. It's like, it's very easy. Go online, don't wait for the book. If possible, I will say that medical college should add Bach remedy as a subject now, because I have seen so much of results now. I really enjoy using it.
Okay, no more questions, ma'am. Thank you for the insightful session. It was really amazing. Anand, you can take over from now.
Thank you, Snehil.
Thanks a lot, ma'am, again. And thanks everyone for your active participation and so many amazing questions. We hope you all found this session very valuable and informative. Once again, a big thanks to Dr. Shilpa Dhoka for sharing her expertise with us today. And thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session, which is scheduled on 23rd of July to be conducted by Dr. Pratibha Sunavne. The topic is PICHU, PISHU, small touch, deep impact. So we'll be ending the session now here. Thanks again, ma'am. And
Thank you,
thanks everybody.
everybody.
Thank you, Sneh.
Thank you, everybody, to listen to me. And thank you, Anand, to have me over here. And feel free to contact me anytime if you have any doubts. I am happy to share. I'm very happy to help out whatever way you can start using it.
Thank you. Thank you again,
Thank
ma'am.
you. Bye-bye. Thank you.
Yeah, wish you all have a great day. Yeah, good night then.
Good night, everybody.
Bye.
Good night.